All right, let's use our Anatomage table to take a look at some of the large major veins of the lower limb and run it from our toes all the way back up to the right side of the heart. So before we've looked at arteries, remember arteries are always taking blood away from the heart, well veins are taking blood back towards it. So let's start far away from the heart in a region like our toes down here and make our way back up towards the right atrium. So if we start down here at the bottom, we can see some digital veins. Remember, digits always refer to fingers or toes. So of course, they've got their own veins, just like they do arteries. We can see those in the metatarsals. Remember, those are the long bones of the foot, sort of like the metacarpals or the long ones up in your hand. So there's digital and there's metatarsal. Once again, good illustration of those there. We can see the dorsal venous arch of the foot, large complex here. We can see the medial plantar and the plantar venous arch, one of the little smaller ones right there. So if we move our picture down a little bit, keeping everything sort of centered here, we get into the leg region. Remember, leg or crural region has two bones, tibia and fibula. So we can see each one of those right here. And remember, the tibia is the larger bone that's found medial, and then the fibula is the smaller, more lateral bone. Well, of course, each one of those have their own veins, just like arteries. So for the fibula, there's our fibular vein, which will be lateral since that bone is lateral. And then with our tibia, right, we've got two associated with it. These are going to be medial since that bone is to the inside. And there's our anterior tibial to the front and posterior tibial vein to the back, right? So one to the front, one to the back. Get down a little bit lower right here, we can see our great and small saphenous veins. The small saphenous you can see draining from the foot all the way up to the knee region right here, and then the very large great saphenous vein, largest blood vessel we have in the entire body. Next up, we see the popliteal. Now remember, the popliteal region, again, is the region behind your knee. So just as we found the popliteal artery behind it, vein, same thing, but of course the vein is draining blood back up towards the heart. Get a little bit higher up into our proximal region right here, a little bit more proximal. We got the femoral region from hip to knee. So there's our femoral vein and deep femoral. Remember, we saw arteries similar to this before. So now we've gotten up through that femoral region. Now once you get back up to the top of this femur, you're going to next run into this external iliac. So we can see that with our femoral and deep femoral running into this external iliac. Now, the internal iliac comes out of the pelvic cavity. That wouldn't be carrying blood up from the lower limb. But again, from those femoral, we're going to hit the external iliac. Then we're going to run into the common iliac. And of course, up from there, we're going to run into the inferior vena cava, coming all the way back up to the right side of the heart. So great little view of those. And let's see if we can move back down here and click through them one more time. So we've got our digital down on our toes. Got the metatarsal and the long bones of the foot. A few of the others closely associated with it, the dorsal venous arch and the medial plantar vein. Plantar venous arch shown right here. Move it down a little bit. Again, lateral to the outside is our fibular vein. Then medial to the inside, we've got our anterior and posterior tibial. There's our popliteal behind the knee. Then there's our small and great saphenous. Great saphenous, again, notice how large it is right there. Then we've got our femoral and our deep femoral. And again, those right there are going to run up to the external iliac, up to the common iliac, and from there up to the inferior vena cava, and right on back to the right side of the heart. So we'll continue with our blood vessels next.